Hello, good morning students. So today we are going to discuss regarding inflammatory bowel disease. Inflammatory bowel disease, so you all know in the name itself, so it includes bowel, so it is nothing but the inflammation of the bowel. So what is bowel? So bowel includes both small intestine as well as large intestine. Inflammation of this both small intestine as well as large intestine occurs in this inflammatory bowel disease. So before going to discuss regarding this inflammatory bowel disease, first we will go with the different parts of your small intestine as well as large intestine, then we will discuss regarding the disease. Small intestine, the first part of the small intestine is nothing but the duodenum, which is followed by the jejunum, and the last part is ileum. This ileum will be connected to the large intestine. So if you see the large intestine, the first part of the large intestine will start with cecum and followed by ascending colon, transverse colon and descending colon, sigmoid colon, rectum and anus. So these are all the different parts of large intestine. Next, coming to the disease. So this inflammatory bowel disease, it can also be called as idiopathic bowel disease. So why we will call it as idiopathic bowel disease means, so it is of unknown etiology. The exact reason or the exact cause which is causing this inflammatory bowel disease is not yet identified. So it includes two diseases. One is Crohn's disease, which is also known as regional enteritis, and ulcerative colitis. So this Crohn's disease will mostly affect your small intestine, and ulcerative colitis which will affect your large intestine mostly. So Crohn's disease mostly affects the small intestine, and ulcerative colitis large intestine. So there is no any specificity that it has to affect small intestine in case of Crohn's disease and it has to affect large intestine in case of ulcerative colitis. It may affect the any part of your gastrointestinal tract or alimentary tract, but most commonly it will affect small intestine in case of Crohn's disease and large intestine in case of ulcerative colitis. And the type of inflammation in case of Crohn's disease, which is also known as regional enteritis, is nothing but a granulomatous inflammation. Mostly it will affect the terminal ileum and colon. And in case of ulcerative colitis, so mostly mucosa and submucosa of the rectum will get affected along with the descending colon. So both of these disorders primarily affect the bowel, but apart from the bowel, even though we are discussing that it is an inflammatory bowel disease, mostly it will affect the bowel, that means small intestine and large intestine. Systemic involvement is also there in case of this inflammatory bowel disease. So it will also affect joints, which results in polyarthritis. It will also affect eyes, which results in uveitis. It will also affect spinal cord, resulting in ankylosing spondylitis. It may also result in skin lesions as well as that means liver. So most commonly this inflammatory bowel disease will occur in second and third decades of life. In early 30s and early 40s we will observe this inflammatory bowel disease, and the females are slightly more affected when compared to males. And if you say ulcerative colitis, so ulcerative colitis is nothing, it is related to colon is nothing but our large intestine. So these different types of ulcerative colitis are depicted in this picture. If it affects the rectum and anus, so if only this part is affected, then we will call it as proctitis. Along with this rectum and anus, if there is involvement of sigmoid colon, then we will call it as proctosigmoiditis. So if descending colon is also involved, then we will call it a distal colitis. If transverse colon is affected, we will call it as extensive colitis, and if the entire large bowel is involved, we will call it as pancolitis. Coming to the etiopathogenesis, we already said it is an idiopathic disease. Idiopathic means unknown cause. But in the development of this inflammatory bowel disease, so there are three major factors which are involved. And those basis, that means on those factors basis, we will discuss the pathogenesis of this inflammatory bowel disease. So those are nothing but the genetic factors, immunological factors as well as exogenous factors. Coming to the genetic factors, so the research evidences are saying that first degree relatives. First degree relatives are nothing but, so our parents are our first degree relatives, and as well as our children. Our children are nothing but our first degree relatives. They will have. So if you have inflammatory bowel disease, it may be Crohn's disease or ulcerative colitis. So your first degree relatives, that means your children, will have 3 to 20 times higher risk of developing ulcerative colitis. So this suggests there is some genetic involvement. And another evidence is saying that in case of monozygotic twins, so Crohn's disease is about 60% risk and ulcerative colitis is 40% risk. That means if in between monozygotic twin, if one individual develops ulcerative colitis or Crohn's disease, so approximately 50% chance of these diseases will be developed in another individual. And coming to the next part, so some researchers identified abnormality in the region of chromosome 16q as well as SCARD15 protein, which is known as caspase associated recruitment domain containing protein. Mutation of this protein results in the development of this inflammatory bowel disease. And if you see the HLA studies, that means human leukocytic antigen studies, so ulcerative colitis is more common in those individuals who are having HLA-DRB1 allele, and Crohn's disease is more common in those individuals who are having HLA-DR7 and DQ4 allele. Next, coming to the immunological factors. So we are all very well known that, so whenever an antigen or whenever a foreign body enters into our systemic circulation, or whenever it enters into our body, our immune system will get activated. But if you see, even though we are taking so many types of foods, so many types of food, but our immune system is not acting against it. We are taking carbohydrates, we are taking proteins, fats, various types of other foods which we are consuming. Against those foreign particles, our immune system is not acting. So why means, so in intestine there is a mechanism which is responsible for that suppression of inflammation. Even if you take some food, even if you take some fatty foods or whatever the food which you have taken, our immune system will get activated, but that activated immune system will be suppressed. So will be suppressed by some cytokines which are known as inhibitory cytokines, so which are nothing but interleukin 10 as well as transforming growth factor beta, so that we won't observe any inflammation in that intestine, both small intestine as well as large intestine. So if there is any defect in the regulation of this immune suppression, suppose if there are no cytokines, inhibitory cytokines which were released during food intake, so at that time it results in inflammatory bowel disease. So that may be either small intestine or large intestine. So next, coming to the exogenous factors, so outside factors which may also cause this inflammatory bowel disease. Microbial factors, there are so many number of microbes, so some bacteria, fungi, this mentioned bacteria, fungi, and so many other microorganisms will cause or will exacerbate this inflammatory bowel disease. And some psychosocial factors, that means behavior of the patient, that means sensitive individuals, those individuals who depends on others for everything and who can't express themselves, as well as in their life there are any major events such as major illnesses, deaths, or family or divorce or interpersonal conflicts. So this will exacerbate the symptoms of inflammatory bowel disease. And even oral contraceptives will also increase the risk of developing Crohn's disease, but there is no much risk in case of ulcerative colitis. So if you see this Crohn's disease, we already said it majorly affects, most commonly affects small intestine, and in that small intestine, most commonly affected area of the small intestine is terminal ileum, and it may extend to other parts of cecum as well as the ascending colon sometimes. And ulcerative colitis, classically ulcerative colitis mostly affects the sigmoid colon, descending colon, transverse colon, and sometimes may involve the entire colon, that means whole large bowel gill gets involved. So these are all the different symptoms of ulcerative colitis, Crohn's disease. There will be pain as there is any inflammation in your stomach, so it results in pain, diarrhea, there will be fever. So as if whatever the food which you are consuming, against that our immune system is acting, because of that you will the food will not get absorbed. It results in weight loss, there will be bloating, and anal pain and drainage will be there. Rectal abscess as well as fissures will be developed. And coming to the ulcerative colitis, you will also observe the same symptoms. There will be abdominal cramping, frequent bowel movements, and we will also observe blood in stools. Ulcerative colitis is related to large intestine. So most of the symptoms which are related, whatever the symptoms which are developed in case of ulcerative colitis, so they are related to, so will be observed in the form of stools. That means that's why we will observe blood in stools. There will be weight loss, and apart from that we will also observe some systemic symptoms we already discussed regarding that, such as tachycardia, blood vision, eye pain, photophobia. We will observe arthritis, and we will also observe some skin lesions. And the complications of this Crohn's disease, so malabsorption, as if there is any inflammation in case of the small intestine, so the major area where our food is getting absorbed is nothing but small intestine. So since there is an inflammation in that small intestine, we will observe malabsorption, and fistula formation will be there. Fistula is nothing but an abnormal connection between the organs. So from small intestine to a large intestine, or small intestine to any other part of the any other part of the gastrointestinal, we will observe an abnormal connection. Generally, the connections between two organs will be either blood vessels or lymphatic vessels. Apart from that, if there is any connection, if it is formed, then we will call it as fistula. And stricture formation will be observed. So that stricture formation will be discussed later in our next slides, and we will also observe development of malignancy. These are all the different complications of Crohn's disease. And next, coming to ulcerative colitis, one of the most important complication of ulcerative colitis, and one of the most severe and detrimental. So it will have a very detrimental effect on human body, which is nothing but toxic megacolon, which is also known as fulminant colitis, where we will observe that means whatever the walls of this large intestine will become very thin, and so they will get perforated. So whenever it will get perforated, whatever the fecal matter which is present in large intestine, it will get sent into the peritoneal cavity and results in some infections. And fistula formation is also observed. So carcinoma may develop in long-standing cases of ulcerative colitis, and stricture formation never occurs in case of ulcerative colitis. So the stricture formation is observed in case of Crohn's disease, but not in case of ulcerative colitis. So this is about the strictures. So stricture is nothing but, so whatever the small intestine which is there, some part of the small intestine will get, that means we will observe some, we will call it a contraction or some other type of formation like this. So like this is observed in case of strictures, and generally in while treatment, so what they will do is, so just they will cut that part, and as well as they will do, so they will give some sutures there, and thereby they will make that intestine proper for the movement of food. And we also discussed regarding fistula formation. Fistula formation is nothing but an abnormal connection between an organ. So here there is an abnormal connection between the anus and some other the buttock region which is there here. So these are all the different things which we have to know as a basic of inflammatory bowel disease. Thank you.